Most of us grow up thinking more medical checkups are always better, especially as we age. But what if I told you that beyond a certain age, some routine screenings might actually put your health at risk? It may sound counterintuitive, but the truth is, not all tests are benign. In fact, many so-called standard exams for those over 70 can trigger false alarms, unnecessary worry, and even harmful medical procedures. This isn't alarmism. It's a movement gaining traction among thoughtful physicians working with older adults. The medical establishment is shifting its focus from more to smarter care, understanding that one-size-fits-all testing can harm as much as help when age changes the equation. In this video, we'll explore 5 screenings seniors might want to skip and why. These are tests many doctors themselves steer away from as they grow older. We'll dive into why these checks are so common, the concealed dangers they pose, and healthier alternatives that help you stay informed without sacrificing well-being. If you value your health but want to avoid over-treatment, this discussion is for you. Let's begin. 1. The non-invasive path over colonoscopy. Colonoscopy has been hailed as the gold standard in colon cancer prevention. But once you're past 70, especially with no symptoms or family history and consistent clean results, it may become more risk than reward. The prep alone drinking gallons of laxative can cause severe dehydration and electrolyte disruption in seniors. Sedation that younger bodies clear quickly can linger in older adults, triggering confusion, dizziness, and falls. And then there's what happens when small, slow-growing polyps are found. Many of these never progress to harm during a senior's lifetime. Yet their discovery can spark a chain of follow-up procedures, biopsies, more scopes, even partial bowel removal. Risks then multiply: bleeding, infection, extended recovery. Story of Mary, age 82, active, no symptoms. Underwent routine colonoscopy prep, became dehydrated, fainted at home, broke her wrist. After weeks in rehab, the colonoscopy showed no concerning findings. The damage had already been done. 2. The hidden cost of whole-body imaging. A full-body CT or MRI sounds reassuring. What if it spots a hidden threat before you do? Sounds great, right? But for those over 70, these scans often unveil incidentalomas, tiny, harmless anomalies that spark fear. Think a 3 mm kidney cyst, a small lung shadow clinically irrelevant, but enough to trigger anxiety. What follows? Biopsies, repeat imaging, possibly surgery, each with its own risks. Infection, complications from anesthesia, recovery setbacks. Example: Helen, age 79, had a discounted full-body scan at Health Expo. Doctors flagged a small adrenal mass. She underwent surgery months later, prolonged recovery, complications, and ongoing health issues, all for a benign finding. Alternative: stick to targeted imaging, only when you're symptomatic or at a confirmed risk. Trust what your body is telling you over blanket scanning. 3. Rethinking routine cardiac stress tests. Cardiac stress tests, think treadmill ECGs, are a staple of heart screening. But beyond 70, they often scare doctors with false positives, triggering invasive follow-ups that may not improve health. Age brings natural changes: stiff arteries, minor ECG shifts, not necessarily disease. Yet, stress tests don't know that. They may flag benign changes as warning signs, ushering in a cascade: cardiac catheterization, angioplasty, stenting. These follow-ups introduce real dangers: bleeding, contrast-related kidney damage, post-procedure complications. True story: Tom, 75 and asymptomatic, had a routine stress test. Results prompted a catheterization, which led to stent placement and a later infection requiring hospitalization. His recovery stretched for months, with lasting health impacts no better than before. 4. Questioning repeat colonoscopies after clean results. Yes, we've already covered colonoscopy, but this requires a second spotlight. Routine colon follow-ups after clean results may offer diminishing returns for seniors. Given that polyps typically evolve over 10 to 15 years, if prior scopes were clear, colonoscopy beyond 75 often presents more hazards: sedation issues, bowel perforations, dehydration. Case in point: Agnes, 78, had prior colonoscopies at 65 and 72 with clean results. Persuaded to do one more, she suffered a perforation during the procedure, requiring emergency surgery. Her independence and vitality never fully recovered. Alternative: watchful waiting. If your colonoscopy history is clean and no symptoms are present, you may skip the next check until or unless you notice warning signs. 5. Overdiagnosis from generic cancer screenings. We've talked about colon and cardiac testing. Now let's zoom out. Many generic cancer screenings or health batteries marketed at seniors like cardiac workups, whole-body MRIs, or repeated colonoscopies often result in overdiagnosis. They target everything, even minor anomalies that pose little threat at your age. These lead to biopsies, surgeries, radiation-risking treatment complications, emotional stress, and draining your reserves. Key point: what once was prudent at 50 full physical, broad testing doesn't always apply at 75. What helps the young may challenge the old. Healthfulness after 70 often lies in restraint, not expansion of screening. Final thoughts. Turning 70 isn't a stop sign, it's a moment for thoughtful adaptation. The medicine that served us in earlier adulthood may not suit the wisdom of later years. Here's what matters most now. Prioritize daily movement, heart health through activity rather than tests. Listen to symptoms: persistent pain, weight loss, blood and stool, new fatigue. Let tests follow signs, not lead the way. Embrace less invasive, personalized checks like stool tests, targeted imaging, and age-suitable exams. Engage in open conversations with your doctor. Weigh test risks versus benefits. Do results actually change your care or life quality? At this stage, health is not about doing more, it's about doing wisely. If this perspective resonates, here's what you can do next. Write "Wise Health" in the comments below. Share this with someone in your life who could benefit. Talk with your doctor about whether the screenings you've had are still necessary, or if it's time to shift focus. Turn aging into empowerment. Honor your body and your priorities. Health after 70 should support your joy, your freedom, and your values, not your fear. Thank you for watching. If this message speaks to you, please like, subscribe, and share to help others age with intention and wisdom. Stay well, stay wise.